Hi guys, it's Dr. Matt Sherwood again with Sherwood Spine and Sport here in Crown Point, Indiana. This is the third video from our low back with sciatica series. Our last video we went over a disc herniation hitting a lumbar nerve, creating sciatic-like symptoms. Today we're going to be going over the situation where a buildup of arthritis in the spine will cause compression on a nerve root, and that will cause our sciatic-like symptoms. So I'll use my model again here. So what happens when we get arthritis in the back? There's a few different spots we can get it. We can get it actually around the disc, where the disc actually starts to shrink and the bones get closer together. That's called degenerative disc disease. What we're going to talk about more in this situation is where the arthritis occurs around the joint. So we have these movable joints in the back of the spine here called facet joints. So when we get arthritis, there's a destruction of the cartilage in between the bones in there in the joint. And what happens with an inflammatory process in our body is our body likes to deposit calcium around those areas. So it's going to deposit the calcium around those facet joints. That's going to get very overgrown, and that calcium will start to intrude into that foramen, that little hole or tunnel where the nerve exits. So instead of having a nice open spot in there, we're going to be very narrowed now, and that nerve is going to be much more likely to have pressure on it and to get pinched. Just what happens from biomechanical perspective, anytime we're standing because of the effect of gravity, the joints will have more compression on them, and that foramen will actually decrease in diameter. Any activities where we're bending backward, arching the back, that's also going to narrow it. So how this presents is quite a bit opposite from our disc presentation from our last video. So our symptoms here will tend to be worse when we're standing and walking. So the leg pain, back pain might get worse when we're doing that, and it will be relieved when we sit. So we can walk, go grocery shopping, whatever the case is, the back starts to ache, we find a place to sit down, and then that pain goes away. This is going to be much more prevalent in the older population as opposed to in our disc injuries, which will usually be in the younger population. Younger, I mean like 20s, 40s, even into 50s. And so as you might guess, in contrast to our disc injuries, these situations we want to avoid more arching exercises, which is the opposite for the disc. Anytime we're arching, we're going to be narrowing that foramen, that tunnel, and that's going to put more pressure on the nerve. So we want to avoid that. More sitting exercises, bending, touching our toes, sitting down, trying to touch the floor, pulling our knees to our chest, our child's pose. That's going to be much more appropriate when we're dealing with this situation here. Things we will do in the office to treat this is we will go where those joints are arthritic, and we'll check for motion. Lots of times, often they're very restricted or stuck. They're not moving very well. So that's where our spinal adjustments are going to help to try to unlock those joints, restore proper motion there, get some good movement, take a little bit of pressure off the nerve. We can use our chiropractic table in here if we have it, which we do in our office, and we can do what's called flexion distraction. So we can have you on your stomach, unlock the table, and then lower the table up and down slowly, put our hand at the levels that are tight and stuck, and we can try to open up that spine and open up those foramen, those tunnels, and make more room for those nerves. And that's very therapeutic. We also can do a lot of dry needling for this. Those muscles around those arthritic joints tend to get very under a lot of spasm. So we can put the needles into those muscles on each side of the spine, the deep muscles, leave the needles in for a little bit and help to release those muscles. And that also helps to have a decompression effect on the joints in the low back and helping to relieve pressure on that nerve. And then of course, exercise stuff at home is super important, and that's what we're gonna go over next here. All right guys, so for this first exercise I'm gonna go over, and it's actually not really an exercise, it's more of a position you just lie in. We're gonna call this a static opener. And what this is gonna do is this is gonna be most effective when there's nerve pain on one side of the, in one leg, sorry. So it's gonna be if we have left-sided leg pain, or if it's on the right side, not both legs at the same time, which is a rarer case, but it does happen. So this would not be applied to that. So for this situation, we're gonna pretend that my leg pain is on the left side, my sciatic pain. So what we're gonna do, you're gonna do this in your bed. You're gonna lie on your side on the edge of your bed, so the bad side is up. So my left side is up, my sciatic pain is on the left side. We're gonna bring our knees up to 90 degrees, and then with the knees bent, keeping them there, we're gonna drop the legs off the side of the table nice and relaxed, and we're just letting them hang like that. And we're actually staying in this position for about 5 minutes at a time. And I tell patients to do this 2 times a day minimum. They can actually do this every couple hours if they're home all day, but 2 times a day minimum. You should actually feel absolutely nothing during this, and that's the whole point, because we're opening that foramen, that tunnel for the nerve, and getting some really good blood flow into that nerve to help take some pressure off it. So we stay about 5 minutes, and then we do this 2 times per day. And this can be an absolute game changer for people with sciatic pain, especially if it's an acute pain. It's unbelievable sometimes. All right, guys, so for our next one here, this is gonna be more, you can do this as well if it's in one leg, but this is gonna be for our situations where we have sciatic going on in both legs, or even if we just have lower back pain that is worse when we're standing and walking, you know, bending backwards, things that we discussed earlier in the video. So this one you can also do in your bed. You can do it on a floor, it doesn't matter. Make sure the head is supported. You have a pillow under the head. I can elevate this headpiece so I don't need a pillow here. Then we're gonna lift one leg up at a time, other leg up. So if you have the core strength, you can actually just hold the legs here and use this as more like a strengthening exercise and to open the spine. But in a lot of people, especially if they're a little older, they're not as strong here, or they're in too much pain, we can put a little, like one of those Swiss balls, exercise balls under our legs, or we can lay on our back and just prop the legs up on our bed. We can prop them up on a chair or table, it doesn't matter. You usually start with the legs 90 degrees here, and these are nice and supported. When the legs are relaxed, it's gonna let everything just relax in the low back, and then this is also gonna help to open up the foramen in the low back and those tunnels for the nerves to get the pressure off the nerve. It's also very therapeutic. Same rules apply for timing. I usually say about 5 minutes at a time, and then we're gonna do this 2 times a day minimum, but more is gonna be more effective. All right, guys, and that concludes our 3rd video for our low back with sciatica. So that was the situation with arthritis causing impingement on a nerve root in the low back. Hope you guys enjoyed that. Any questions, comments, anything, please comment below. Have a good day.